Hi, everyone. Welcome to our webinar, Virtues and Vocations, Conversations on Character and the Common Good. In this series, we share conversations about how education and work can promote human flourishing. This series is part of Virtues and Vocations, a national forum housed at the Institute for Social Concerns at the University of Notre Dame and supported by the Kern Family Foundation. I'm Suzanne Shanahan, and I direct the Institute for Social Concerns, and I'm host of this series. Virtues and Vocations is an effort seeking to foster a community of practice amongst scholars and practitioners across disciplines who are all keen to understand how best to cultivate character and moral purpose in higher education and the professions. This webinar is one way we facilitate these conversations. Today, we are thrilled to welcome Dr. David Sandberg. Dr. Sandberg is a recently retired pediatric neurosurgeon. Until July 2025, Dr. Sandberg served as Director of Pediatric Neurosurgery at McGovern Medical School, Children's Memorial Hermann Hospital, and the University of Texas, MD Anderson Cancer Center in Houston. He received his undergraduate degree from Harvard University and his medical degree from the Johns Hopkins University School of Medicine. He completed neurosurgery residency training at the Weill Cornell Medical College at Cornell University, New York Presbyterian Hospital. After residency, he completed fellowship training in pediatric neurosurgery at the Children's Hospital Los Angeles. His major research interest involves novel delivery methods to treat malignant brain tumors in children. Dr. Sandberg has been principal investigator of several clinical trials, testing direct infusion of chemotherapy into the brain to treat recurrent malignant brain tumors in children. He also has a long-standing interest in neurosurgery in low and middle-income countries. In 2019, he received the Humanitarian Award from the American Association of Neurological Surgeons, one of the very highest honors bestowed by his organization. Today, we will have a conversation about with him about his recently released book, Brain and Heart: The Triumphs and Struggles of a Pediatric Neurosurgeon, a medical memoir that explores the thoughts and emotions that accompany the responsibility of making complex medical choices with life-changing consequences. We look forward to a conversation with Dr. Sandberg on courage, love, compassion, hope, and the other virtues that shape his vocation as a pediatric neurosurgeon. Welcome, David.
Thank you so much, Suzanne. It's such a big honor to be here with you.
Well, thank you for joining us on this lovely day. Let's jump right in with a bit of a discussion about how you came to this wonderfully thoughtful and moving book. In the introduction, you describe why you wrote it and for whom. I'm hoping you can share a bit about that with us here.
Yeah, there are many reasons in different audiences. The first is, as I went through my career year after year and more than 2 decades now, we accumulate great stories. And I often thought to myself, these stories need to be shared. Stories about compassion, stories about great triumphs, stories about huge failures and complications. There are many books that discuss medicine from the patient's point of view. And there are a few books that truly let you into the mind of your child's doctor or your doctor. And one of the things that I think is unique about this book is I really let others who are reading the book know what I'm thinking. So I thought that would be useful to patients and families who've been through tragedies, who've had their children diagnosed with brain tumors, things like that. The other is for students, high school students, college students thinking, is a career for medicine, career in medicine, is that for me? Medical students who are deciding what specialty to enter within the field of medicine, to see what a field like neurosurgery is actually like from the inside, with honest views of what we go through in our training, what we go through in our daily lives. Are they capable of having the hard conversations, things like that. And then, just for the general public, anyone interested in interesting medical stories.
Great, thank you. One of the things I was really taken by is how you described your journey to becoming a pediatric neurosurgeon, and in particular, your earlier days as an undergraduate. Notre Dame, like many elite private schools, has probably more than 40% of our students coming in aspiring to work in some field of medicine. And so I found it very interesting that you first described kind of an experience with the unhoused and working with homeless populations. Can you talk a little bit about how that work got you thinking about a future vocation?
So my father was a physician. He's recently retired. He's an ophthalmologist, and he really inspired me to go into medicine. I wanted to be like him. He was my hero. He took me on some medical missions to Dominican Republic, Jamaica, and Antigua that were really impactful to me. I approached medicine from the service standpoint. There are some who approach it more from the science standpoint. I was a history major in college. I grew up in a sheltered environment in North Miami Beach, Florida. I never knew what winter was like. And when I went to Boston for college, I was shocked that I was still cold despite the huge, big blue winter coat that my parents had bought me. And I was shocked further, and very naive, of course, that there were people sleeping on the streets in the dead of winter. And it was so cold. And I was rushing to get back to my dorm or to get to classes. And I wondered why this was their best option. I began to volunteer at a student-run homeless shelter and wound up becoming, a director of that shelter, looking at ways to transition the unhoused from the streets to jobs and permanent housing. Um, I thought I was going to wind up doing something in medicine related to indigent patients, primary care, perhaps internationally, perhaps domestically. But once I got to medical school, I encountered neurosurgery and fell in love with that specialty, and I knew that's what I had to do.
So can you talk a little bit about um, that transition to finding neurosurgery, and what about that specialty just drew you in? And did that have anything to do with how you describe your interest in medicine emerging from service, not from the scientific research dimensions of it?
Yeah, there are some individuals who know they want to be a neurosurgeon from the time they come out of the womb. I was clearly not one of those individuals. In medical school, you do different rotations. And one of the important rotations for me was emergency medicine, because you see who comes in the emergency room and you see where they get triaged. And I found myself intrigued by the surgical patients. They came in with acute problems. Um, it wasn't just the surgeries when I did my surgery rotation, it was the conversations actually between surgeon and patient, where a patient comes scared out of their mind and a surgeon says, here's your problem. Here's what I can do to fix it. Goes over risks and benefits, or says, I can't fix it and nobody else can either, and explains, how terrible that feels. Um, I thought that work seemed very, very compelling. And then neurosurgery specifically, I wanted to try different surgical subspecialties because I was intrigued by surgery. I spent a month on the neurosurgery service. I've never worked harder as a medical student, but I wasn't tired. I was up all night, night after night, but I was amazed at, first of all, the passion of the individuals doing the work, how much they cared, how much they loved the work. They treated me so well. It was really a team environment. Um, and I caught the bug.
So you describe this, it's sort of moment of falling in love with neurosurgery. And I think when the average person thinks of a neurosurgeon, um, they don't think of them, at least many people, in terms of compassion and humility. And the way you describe the esprit de corps, the energizing environment, the care, the compassion, the kindness, um, was this something that you found almost universally among surgeons and neurosurgeons in particular, or was this an unusual environment that you then hope to cultivate where you went after that experience?
Surgeons have a reputation of being a little bit rough around the edges. What I've encountered in my career are surgeons who are incredibly passionate about what they do and really care deeply about patients and their families, and for the most part are very good people. Neurosurgery, you think of neurosurgeons as, they may be pompous, they may think they're very smart. In truth, neurosurgery is quite a humbling specialty. The brain is very unpredictable, and sometimes you do your very, very best, and the patient is worse neurologically than they were before the surgery. And when that's a child, that hurts really badly, and it breeds humility, not, hubris. Um, in terms of, you know, kindness or compassion, I love children, and I've always had great sympathy, which has been heightened since I had my own kids. And you see what goes into raising a child and how much I love my own children. And you imagine getting the news that I deliver, being on the receiving end of that news. I have compassion for those families and those parents and those children, and amazement at the bravery that they show. I'm inspired by them. And then figuring out whether it's for me, somebody has to have these really hard conversations in which you tell a parent their child has died or their child has a brain tumor. I think how those conversations go is so important and makes a huge difference, perhaps for the rest of that family's life. Those are conversations that will be remembered forever. And I thought that somebody has to do it, and it should be me.
That's yeah, I find that incredibly moving and poignant. Um, in the first chapter of the book, you tell the story of Garrett, who had suffered a traumatic brain injury, and you describe this one of these conversations with his parents, and you note that you tried to do so with kindness and compassion, but also brutal honesty. Um, that's a really hard combination to bring to a table. Can you talk a little bit about the story of Garrett and that conversation with his parents for the audience?
Yeah, the story of Garrett was meant to show the uncertainty. When you think of neurosurgery, you think of a field that's very technical, and we can do amazing things with amazing technology. We can target deep brain tumors with devices like frameless stereotaxy and robots, and it's precise and all that. But there is so much imprecision. There's so much that is not defined by existing medical literature. So Garrett's case is a case of a relatively straightforward problem in neurosurgery, a severe head trauma. There's a big blood clot. It's shifting over the brain. Typically, you would take that patient to the operating room emergently and remove that blood clot and hopefully save that patient's life. The problem is, by the time Garrett got to our hospital, his neurological examination was so poor that I wasn't sure if he had progressed to brain death initially. He had no reaction when I shined a light in his eyes. When I pinched him as hard as he could, he didn't move. He wasn't breathing above the ventilator. His pupils were large and non-reactive, which is a terrible sign. And so there was no definite signs of brainstem function. I pinched him as hard as I could, 3, 4 times. And then finally, I pinched him one more time, and he did this, his arms extended. That's called extensor posturing, which is not a good thing. It indicates typically severe and permanent damage to the brainstem. And, I had not seen children with that degree of impairment who had good outcomes in general. Most of them had terrible outcomes. So I had a brutally honest conversation with his father and then his mother when his mother arrived, in which I said, we could take him to the operating room and take out this blood clot, but I think there's a very good chance he's going to progress to brain death regardless. And I think even if he survives, he is unlikely to be the child that you know and love and you've raised. And I described children who are fed by tubes, who are bedridden, who are nonverbal, non-ambulatory, blind. And the question is, do you want that for your child, right? And I wound up taking Garrett to the operating room, and he made an absolutely miraculous recovery. Today, it's as if he never had surgery. He played on the golf team in high school. He, works at a nuclear power plant. He's a joy. He's an amazing, amazing kid. And to his parents, I'm the hero. I saved their child's life. But what I talk about in the book is how his case haunts me because I truly advised them, if this were my child, I would not take him to surgery. Thinking of the hundreds of kids who I have taken to surgery who have bad outcomes in similar circumstances. Um, so that story was meant to show the imprecision of what we do, which should be terrifying to the general public.
So it's also an extraordinary story of humility, in that it is something that haunts you about this. And you have this opportunity and this responsibility with parents to provide them the best information you can. But it's also, you have extraordinary, I don't know if it's control or an ability to shape family decisions in these moments. How is it that you're able to kind of navigate the kind of weight of that responsibility in a conversation with a parent, where you're trying to give them all the information they need, but also allow them to make a decision that they're going to feel okay with?
Yeah. So there are some decisions that are or should be black and white, right? If Garrett came in with that blood clot and he had a better neurological examination, it would be a no-brainer. You go immediately to the operating room. You don't even have the discussion with the parents for very long because you got to get that kid to the operating room and save his life. If he was definitively brain dead, you don't have that discussion. The hard thing are the gray discussions.
Mm.
And I think, you know, a combination of a few things, listening to the parents, not just talking, particularly when there's time, um, brutal honesty, not sugarcoating things. I've seen a lot of doctors sugarcoating bad news. It never serves the patient well, it never serves the family well, and it never serves the relationship well between doctor and patient and family, which has to be built on a sacred trust. And then compassion, putting that family, putting yourself in their shoes. God forbid, I've given horrible news hundreds and hundreds and thousands of times, but you never know how you're going to react when you're on the receiving end of that news, even if you've given it hundreds of times. So just having compassion, saying words that you would want to hear if you were in their shoes, and having to make these impossible decisions.
So I appreciate that. In your conversation about these hard conversations, you talk about the brutal honesty, the listening, and the compassion as this sort of three-part way that you proceed. How did you learn to do that? Are you just a naturally frank and compassionate person, or was this something others modeled for you in your training as a neurosurgeon?
It's funny, it may be better at some medical schools these days, but I received a lot of training on how to do brain surgery. I received zero training on how to have difficult conversations, none in my entire career. But I watched as when I was a medical student, and when I was a resident especially, I watched my mentors have some of these difficult conversations. Sometimes I cringed because it was awful what they said. Um, just not mixed in with the appropriate level of love and compassion. And sometimes I was like, wow, that was really well phrased. And so what I do now as a teacher, as a faculty member, is whenever I'm going to have one of these horrible conversations, I look around and I hope that there's a resident or a medical student or somebody younger than I am around that I can take with me. And as I'm walking quickly to have that conversation, I tell them what I'm going to say and how it's going to go. And and afterwards, I check in with them and make sure they're okay emotionally. And then I tell them, you should take what you liked from that conversation and employ it when you have to be the bearer of bad news one day. And what you don't like, don't use. And, watch a lot of people do this and pick the best from each of them. So I didn't really learn from any instructor or anything. It's just by watching other people and picking the best and the worst and making a plan.
So I find that really interesting that you weren't trained on how to do this, and yet you approach it with extraordinary integrity, and it seems a consistency. So the honesty, the compassion, the listening, um, are these things when you're training new neurosurgeons that you talk about those virtues of compassion or honesty as something you think others ought to cultivate? Or is your approach more to say there are different ways to do this and they have to be authentic to who you are as a person to match the kind of way you want to be in the world?
I think you have to be authentic and you have to be true to yourself, But I do feel that there's a right way and a wrong way to, for example, tell a family that a child has died, you know? I think, you know, there are things that would be horrible, like doing it standing up, like not, saying how sorry you are, that your heart goes out to that family. Um,
Mhm.
it would be wrong not to include expressions of compassion, of love. It would be wrong not to wait patiently and listen to what the family says, how they react, and try to comfort them and try to answer their questions honestly. It would be wrong to be wishy-washy, right? I think it would be wrong to give false hope. Um, so I do have strong opinions about how it should be done.
So I sometimes wonder when in general when people are going to have a challenging conversation that sometimes that people are wishy-washy um out of lack of confidence, that they're not confident in how a conversation is going to unfold, or confident that they can be kind and compassionate and at the same time be straightforward and analytic and honest about something. Um, do you ever struggle in those conversations with confidence in your ability to do this well? Or is it at this point you feel like I'm kind of good at these, and this is sort of something extraordinary I can bring in difficult times?
I don't struggle with these conversations. They come naturally to me, maybe after years of doing them. Um, and I often feel like I'm undoing bad conversations that have preceded me. I'll
Mhm.
give you an example. There are certain brain tumors. There's a brain tumor called diffuse intrinsic pontine glioma. It's the worst cancer diagnosis in medicine. It happens to children typically in the second half of the first decade of life. So you got a 5 or 6 or 7 year old kid. Um, they present with various neurological problems. You make the diagnosis. Surgery is not an option. Radiation therapy helps temporarily, like for a few months, and there is no chemotherapy agent alone or in combination that has ever helped. And the children die universally within a year, and they have a horrible death, right? So can you imagine anything worse, right? So I've heard others come in and talk to families and say, well, we can try chemotherapy, we'll give radiation, it should, you know, help with symptoms. And I think to myself, these parents deserve to know the truth. And so I sit down with them sometimes after a conversation like that, and I will say, listen, there is no easy way to say this. I have children. I'm upset when my child has a cold. I know how much you love your child, and I say the name of the child, of course. Um, but I need to be honest with you. I need to tell you the truth. And this is a horrible, horrible situation. And I explain that there are different options for brain tumors, that none of the options are possible, and that this is going to have an unhappy ending no matter what we try. And that frees them to grieve and it frees them to make decisions that are rational, right? If somebody says, well, you can try chemotherapy without saying no chemotherapeutic agent has ever worked ever for this diagnosis, you're likely going to choose chemotherapy, but you might want to choose instead to go to Disney World and create a special memory while your kid is neurologically able to do so. That's a choice, whether to enter a clinical trial or things like that. So, in any case, that's an example of the importance of having a brutally honest conversation, not sugarcoating the truth.
Do you think that that way of being is something you carry into the non-medical dimensions of your life? That care and compassion simultaneously combined with brutal honesty? Is that how you are with your kids or your friends? Is
I
this
mean,
sort of David's way of being in the world?
I'm a little different at work than at home. I think the bridge is gratitude.
Mhm.
I am so grateful for my own health, for the health of my family, my children especially. I come home after these conversations and, I definitely hug my kids a little harder and don't tell them why. I don't discuss work with them very much. My wife a little more so, but even my wife, I keep some things to myself. Um, and I'm kind of joking and playful and, you know, regular guy at home. So I don't think I apply, other than just gratitude.
Mhm.
I don't think I apply the lessons at work to my life at home. It's separate.
Um, One of the things that you describe in the book is sort of how you've come to this sort of work-life balance, and you talk about how you can, in fact, be a pediatric neurosurgeon, devoutly committed to your work, working long, long hours, and at the same time, right, have a flourishing family life. Can you talk a little bit about that? Because I do think it is um, sort of a misnomer or a way of thinking that lots of people have. Either you're a doctor or you're all the other dimensions of what it is to be a human.
Yeah, it's a little easier now in terms of the training because there's restriction of work hours, and that's a whole discussion I have in the book about whether that's a good or a bad
Yeah.
thing. Back when I trained, the hours were beyond brutal, and so I was making my decisions in that era. My dad, who had my best interest at heart, he thought I was crazy going into neurosurgery because he was a family man. He was an ophthalmologist and he got home at a reasonable hour. He worked hard, but he was there for family dinners and he knew how important, family was. And I knew how important family would be to me. The problem is you've got to do something. And this is what I tell young people. You have to do something you're passionate about, and I found a passion for neurosurgery, and then I decided I'm going to make it work with all the other things. And I've never missed an important family occasion or a birthday. I've missed plenty of like my son's soccer games. I've missed, a few things here or there, but not the major things. As you become a faculty member, you have control of your life, of when you're on call, when you schedule surgeries and things like that. Um, I think quality time is super important. I'm proud that I think, one of very few neurosurgery surgeons who are male who changed half the diapers. My wife is a busy physician herself. I changed as many diapers as she did. I was and remain equally involved in the life of the family. And I guess the proof of success is my kids are fabulous, and I have a warm and loving relationship with them and a happy marriage. And so it is doable. It is hard, but it is doable.
Yeah. Can you share that statistic that you cited about divorce amongst surgeons that you cite in the book? Because I find it fascinating.
I don't remember the exact statistic in the book. I do remember that there was one residency program that was famous for having higher than 100% divorce rate, because there are some who got married and divorced twice during their residency program. That's not a badge of honor.
Yeah, no, that's great. Um, as you as you think about this space of medical training, um, you describe being trained at a time where hours were limitless, and now there's much more sort of regulation or constraint around that. As you look at medical education now, um, you're in charge, can do anything you want. What are the kinds of things you would change about current medical education?
So if I could change one thing, and I hope this comes out in the book, what I would change is I think medical students somehow, they're not exactly taught this, but maybe they're taught by example that there should be a certain professionalism. There should be a certain distance between themselves and the patient in order to maintain that professionalism. And what I've found in my career is that the opposite is true. The opposite breeds connection, that it's okay to show your emotions, and I give an example in the book of a patient named Jocelyn. I use her name with her family's permission, of course. And this was a little girl who was the cutest little girl you have ever seen, who had a little bit of a crooked smile because she had some weakness of her facial nerve. She had a recurrent malignant brain tumor that came back despite multiple surgeries, radiation, and chemotherapy. And she came to Houston for one of my clinical trials where we were infusing drugs into the fourth ventricle, a certain space in the brain, to try to blast that area with drugs to get high drug levels and cure cancer. I talk about my interactions with her and with her family. Every time she would walk for me, I would ask her to walk, she would skip, doing more than I asked. And I have this image of this little girl skipping down the hall. After many infusions of drugs into her brain, the moment of truth arrived where we got an MRI scan and I was sitting at my desk. I described feeling so anxious about this MRI scan because there was nothing left to offer. If it worked, there was hope, and if it didn't work, then she was going to die and no other treatments were going to be offered. And I couldn't focus. Usually I'm very efficient. I'm doing 100 things at once. I couldn't focus. I kept hitting refresh, refresh, refresh on the screen. And when her images came up, it was devastating because her tumor had doubled in size, laughing at the treatment that I tried to give her. So then I had to go and have the conversation with the family and tell them this news. And normally I walk quickly from place to place because I'm in a rush. But I found myself walking very, very slowly, I guess reflecting my reluctance to have this conversation. But there was nowhere to run or hide. And I had to have this conversation. And I sat down with this family, with these parents, these wonderful parents, Nicole and Michael. And as I started showing the images and explaining where we were, I just started to cry, and not a little. Not, I've had tears in my eyes here and there in front of families, but I started bawling. And was thinking to myself, this is totally inappropriate. Like, who am I to show my emotions? My grief is 1/1000th of what the parents' grief is. And I felt a little embarrassed by it. And then um, years later, a few years later, I'm in touch with the family, they're dear friends. I said to Nicole and Michael, I said, you remember that conversation, of course, and you remember my emotions. How did that make you feel? Like, I felt like that was unprofessional at the moment and things like that. And they were like, no, no, no. They said, we felt like you were in it with us and it meant the world. And so if I could convey that to medical students, that would be the one thing I would convey. It's okay to put your arms around a patient. It's okay to put your arms around a patient emotionally and make yourself vulnerable. It breeds connection and it breeds caring connections.
That's great. If you were to try to summarize that way of being or other ways of being in terms of virtues that you would aspire every medical student graduates with, what would they be? You talk a lot about honesty, humility, compassion. But if you had to name one, two, three things, what would you say are the most important virtues to orient the life of a physician or a surgeon?
Yeah, I mean, a surgeon specifically, I think a focus on 100% honesty is, along with compassion, is really crucial. Um, I specifically think of that in the context of surgical complications.
Mhm.
All of us have complications, right? No matter how well trained we are, no matter how experienced we are, there's not a surgeon that doesn't have complications. The question is, what are you going to do when you have a complication? And as I talk about in the book, there are different extremes. If I have and as I said, brain surgery is humbling. I can operate on a brain tumor in a child and everything's perfect and they wake up perfectly and the tumor's out and the MRI looks clean and they're cured and I'm the hero. And the next day, I can operate on a very similar appearing brain tumor in a similar location of the brain in a similar age child. And the child wakes up and I do the same exact thing as I did the day before. And the child wakes up with new weakness of the left hand or new speech disorder or new visual impairment or something horrible that they're going to have to cope with the rest of their lives, right? So what should I do with that information, right? On the one hand, I could say, you know what? I'm an experienced surgeon. I've been doing this for over 2 decades. I trained at the best places in our country. I have loads of experience with this exact problem. People come to me from various places for me to do these operations. It's not my fault, and kind of wash my hands of it, right? And I think if you have that attitude, you probably don't deserve the privilege of being a physician or surgeon. On the other extreme, I could say, oh my God, this wouldn't have happened if name your favorite neurosurgeon did that operation. And you can become so devastated by a complication that you don't want to go on and treat the next patient. And you shy away from difficult cases, passing on them. Or when you're in the middle of a difficult case, you leave half a tumor behind because you're afraid, right? That doesn't serve anybody well either. So I think there's a happy medium between those two bad extremes. In the happy medium, you deeply, deeply reflect and honestly, what could I have done better, right? It may be nothing, but usually there's something. What could
Mhm.
I have done better in the communication with the family before surgery about risks and benefits? What could I have done during the surgery differently to prevent the complication? What could I have done better in the postoperative period? And then, we present these cases in morbidity and mortality conference, which is like showing your worst day in front of, 50 to 100 people with pictures and video to boot. Those discussions are so important, and we learn from honest discussion. So I think being honest with yourself and being honest with others about your complications is one thing I would want to impart.
Do you, throughout the book, both your journey to becoming a pediatric neurosurgeon, but also through your work, I wonder if you ever had a moment of profound doubt that this was the right path for you. Was that ever a moment that you said, I have made a mistake, and I need to rethink my vocation?
I never had that moment. I've had some lows, you know, with complications where I've made kids worse than they were before surgery. Um, I've had horrible outcomes where a child dies despite my best efforts to save their lives. The research has been particularly humbling because I was dealing with a patient population that had a very, very poor prognosis. Um, but I had so many moments of joy, and the joy far exceeded the pain. And I never for a moment doubted. I was only grateful for having the opportunity to be a pediatric nurse.
That's extraordinary. Um, would you mind sharing a little bit about your decision to retire? You're still quite young.
Yeah.
How did this come about?
Yeah. So, unfortunately, at the height of my career, I was 53 years old. I'm now 54. I turned 54 in August. I started developing a slight tremor of my right hand. And after seeing three neurologists, it was very subtle, and it's still pretty subtle. I'm not even on any medications. I was diagnosed with early onset Parkinson's disease. And, actually, I was doing surgeries. My surgeries were going great. And I was advised that I could continue doing surgeries for a few years. The tremor is a resting tremor. So when my hands are in motion, like under an operating microscope, it actually goes away. But, I never wanted to be one of those individuals. You think of athletes, professional athletes who are amazing in their prime years, and then they stick around a few years too long, and you wish you didn't see those years. I never wanted to do that as a surgeon. There are some surgeons who retire too late. So I thought I would retire at 65, maybe 70 at the latest. There are some who stay on into their late 70s, even 80s, and continue operating. I never thought I'd retire at 53. But once this diagnosis was rendered, and I know the natural history of the disease, I know that I'm going to get worse slowly over time. I decided that I need to go out absolutely on top. And so, in January of this year of 2025, I shocked the world and basically first told my family and then, my patients, my colleagues, and stopped doing surgery cold turkey and retired in June.
So, what is that experience like having been in those challenging conversations as a physician to be on the other side of that and now being a patient?
It's really hard. It's much better being on the doctor's side than on the patient side. So I have even more sympathy for the
No.
patients who have been on the receiving end of the news that I've given. Um, and I've had definitely some hard moments over the past year. Super hard to tell my children about the diagnosis, hard to tell my parents, my sisters, hard to tell my patients and their families. I've developed amazing relationships with a lot of families, and we had a shared vision that I was going to take care of their kids forever, right? Or at least for a number of years and throughout their childhood. So that's been really hard. Um, on the other hand, once I kind of shared the news with everyone and got everything off my chest, um, I felt a certain freedom and I felt my happiness return to its baseline. And I feel immensely grateful for so many things. I'm grateful that this happened in my 50s instead of my 30s and 40s. I'm grateful that I've had the opportunity to save really thousands of kids' lives. And um, I'm grateful that I've not received worse news. I've given worse news than I've received. I'm not dying. I have hopefully a normal life expectancy and hopefully many more productive things. And I'm going to do great things.
I think that's an extraordinary perspective that I I think bespeaks the joy and alacrity you have brought to your entire career to be able to have that sense of profound gratitude at this moment. It's wildly impressive.
Thank you.
Oh, yeah, just wildly impressive. I want to turn a little to some of the questions that have been popping up from the audience. So,
Sure.
um, first one, so how do you cope with parents who are unable to handle the bad news that you sometimes share with them?
Yeah. So there are so many different reactions to bad news. As I describe in the book, um, there are some parents who sit there silently and don't say a word and stare right ahead and don't cry. There are others who are crying and bawling. I've had patients literally throw themselves on the floor. There are some that scream so loud that it creates a scene that people are looking from every direction. There are some who ask a million questions, and there are some who ask none. There are some who are very sophisticated and others who are less sophisticated in the questions that they ask. There are some who just can't accept the news and they say, please do something different. Save my child. This is my baby. Um, what I teach others, students and others, is that every one of these reactions is absolutely normal. And you just need to accommodate your approach to the information you're receiving and the emotions that you're witnessing in that patient and their family. Um, that's the best I can answer that question.
Great. Um, okay, this is from a current medical student
Yeah.
um, who is sharing one of their main concerns is about, in choosing a specialty, is about burnout. Have you encountered burnout? Is there an emotional, compassionate burnout, surgery burnout? Um, have you encountered it? Do you see it in others?
I mean, there's a lot of discussion about burnout these days. Um, Most of my colleagues in pediatric neurosurgery specifically, when I've discussed this topic with them, say that they're not burned out. And I think it's because they love their job so much. Um, I had no moments where I was burned out. Yeah, I had moments when I was tired or wished I didn't get woken up 6 times in a night when I was on call. Um, but I never personally experienced burnout. To me, I think that comes from having made a wise choice of what's good for me in my career. I remember as a medical student going through the different specialties, and there were some days where I would, they weren't so long. I would get to the hospital at 8 or 9, and I'd be home by 5 or 6. And some of those days seemed so long. And then there were other days where I would get to work at 4 in the morning and come home at midnight, and the day passed by so quickly and I didn't feel as exhausted at the end of the day. It sounds crazy, but it's true. Um, so burnout's a real thing. You have to know yourself and what your needs are regarding, sleep and, outside activities. There's not a lot of room when you're a pediatric neurosurgeon in the height of your career for hobbies. Basically work, family, and exercise when I could. And other hobbies kind of went by the wayside because there just wasn't time. Um,
I think it's somewhat paradoxical that such an intense specialty would be accompanied by such an ethos of energizing and joy, and I just find that really interesting. Um, okay, next one. Do you have advice for aspiring medical students? I'm a college student currently studying for the MCAT.
yeah, I mean, here's the advice I would say. I've never it's very hard to get into medical school these days. And then it's hard to get into competitive specialties like neurosurgery. It's harder than it was when I was going through the process. Um, what I would say is it's worth it. It's worth the effort and the work, and it takes work. I've never been the smartest person in almost any room that I've been in. I've often been the hardest working, and the sacrifices that I made were real. I remember, and I talk about this in the book, one night where I missed a bachelor party of one of my best friends because I was on call in the hospital. I couldn't find someone to switch call. And I remember running around the hospital at 3 in the morning, and I was having so much fun. I was saving people's lives and doing surgical procedures and putting out fires. And I was thinking to myself, I'm probably having more fun than those guys at the bachelor party, which meant, number one, I had chosen my career wisely, and two, that I'm a little bit crazy. But what I would say is it's worthwhile. You have to miss a party, miss the party, get a good grade on that test. I mean, there you have to have balance. So, I'm not saying lock yourself in a library for the rest of your life, but the sacrifices are worth it.
That's great. Um, how do you remain compassionate early in your training during residency when you're pulled in so many directions to publish, learn, teach, lead, mentor, etc., all while working long hours?
I mean, if you've sacrificed the compassion for any of those reasons, then you need to recalibrate yourself because, you know, it is such an amazing privilege to be a physician, to have the opportunity to take care of patients, to do the surgeries. The surgeries are so much fun. It's really fun to walk into a room and open up a skull and see the pulsating brain and then remove a portion of that brain that's causing a problem or a tumor that's pressing on that brain or within the brain, and then see that patient wake up. I mean, it is such a privilege to do what we do. And you're dealing with real human beings who are going through the worst moment of their lives. If you can't preserve that compassion, then you should try to do something else with your life.
That's great. What new technologies and procedures do you see ahead for neurosurgery? And what moral and ethical challenges will they not present to practitioners and patients?
Ooh, that's a great question. I don't know how good I am at predicting the future. What I would say is neurosurgery has become less and less invasive and will continue to do so. There are many surgeries that used to require a big incision in the scalp, taking off a big piece of the skull, that we can now do through tiny incisions that you can't even see, with little holes in the skull, little burr holes, and needles or electrodes and things like that. I think the future is both incredible and also somewhat scary. I think there is going to be more and more restoration of function. When you think of like Elon Musk's company, Neuralink, there's a potential that we're going to be implanting electrodes or devices of some sort in the brain that are, working with artificial intelligence that are going to work on the brain-mind interface and be able to make humans, you know, have better language function if their language is impaired, have better motor function if their motor function has been impaired, restore vision. I think those are amazing and clearly not controversial. I think what would be controversial would be if we find ways, which I think is possible, to enhance normal people, right?
Mhm.
I don't know what the ethical questions are that are going to be raised, but there are going to be some.
Right. Um, Here's one from a parent. My daughter will be a freshman in college next fall and is planning on pursuing pediatric nursing. I am personally concerned for her mental health because she's so empathetic, especially towards children. What's the biggest piece of advice you would pass along to her as she makes her way down this career path? And do you have any advice for me as her mom to help her keep the course down this path?
I have more advice for you than I do for her. My advice for you is to lean into her career decision. Nursing is the most wonderful field. Nurses are at the bedside hour after hour, helping alleviate pain and helping provide comfort to families. They are on the absolute front lines. And if your daughter is a compassionate person, lean into that compassion because she is going to have a meaningful life and a meaningful career. I worry about, you know, kids who choose careers that don't provide them with that meaning, right? And many of them, I think, wind up struggling later in life, saying, what have I done with my life? Your daughter's not going to have that problem. She's going to, and this is no judgment on any career whatsoever. People should do what they're passionate about. But your daughter, I think, knows her heart and she's going to be able to do it and she's going to get through it emotionally and you're going to be there for her.
That's great. Um, One other question here. Can you say more about humility and confidence? You said something about the surgeon responding with humility, not hubris, and I'd love to know more about this.
Yeah, that's a great question. So I think you want your doctor and particularly your surgeon to be confident. Like like neurosurgeries or neurosurgical procedures are very challenging. Some of them are very technically challenging. Some are quite easy, but others are very technically challenging. You want your neurosurgeon to go in thinking that he or she is the right person for the job, right? With confidence based on their experience. You also don't want them to be cocky, to take undue risks. You want them to understand their limitations. Um, what I tell residents when I'm teaching residents how to do surgeries is before surgery, we talk about risks and benefits. And we recommend surgery if the risks are outweighed by the benefits. Where some neurosurgeons make a mistake is they don't recalibrate that risk benefit ratio during the surgery. So, based upon unexpected things. In other words, you go in to remove a brain tumor and unexpectedly the brain starts swelling, right? So then you have to decide, do the risks of doing this surgery, are they still outweighed by the benefits? Or is it safer, to bite your tongue and come back another day and just close up and go back and have the hard conversation with the family? The surgery wasn't safe today and I couldn't do it today. So we're going to have to let the brain settle down and come back in a few weeks, right? That's a hard conversation to have. But you have to have both the confidence that you're doing the right thing and the humility to not push ahead in those circumstances. It's a hard balance.
Great, thank you for that. As we wrap up, I wonder what you're most hopeful about right now in your retirement. Um, what is animating you after having this extraordinary career as a neurosurgeon?
Yeah. So I have had extraordinary opportunities to help children in my life. And there are many ways to help children, not just by doing operations. So, because I have a tremor in my hand, I've stopped doing surgeries, but that doesn't mean I can't help children. I'm in the process of finalizing a job position, hopefully, where I'm going to be working to help homeless youth, transition from being unhoused to getting good jobs, working with companies, trying to get them to offer better jobs to kids. I'll spare the details because it's not finalized. Um, my wife said something that I think about all the time, which has been really helpful to me. You start as you get older, and particularly as you retire, you start thinking about what your legacy is. And what my wife told me, Amy, is that there are different stories that could be said about me when I'm gone. One is that I was a pediatric neurosurgeon. I saved a bunch of lives. I had meaningful relationship with families, and that would be good enough. That would be great, right? But perhaps an even more powerful example for my children, for our children, is I did that, and then life threw me a very difficult curveball. And I showed resilience and I went on to do something else that was meaningful. So I have great optimism that I've got a lot of bright days ahead.
I love how it's a return to your time as an undergraduate to a certain extent, uh,
Yeah,
and that compassion and commitment to the unhoused has remained steadfast. So I find that just extraordinary. Thank you. And with
thank,
that, we're going to call it. I'd like to thank everyone for joining us today. Please do check out the book. It is just a beautiful, beautiful story of an extraordinary human being. Uh,
thank you.
so
Thank you so much. What an honor it was to be on with you today.
yes, this is just really, really moving and important. So thank you.
Thank you.
Please join us next time on November 3rd for a conversation with New York Times book critic Jennifer Salia on whether empathy is a threat. So thank you again, David.
Thank you,
All the
Suzanne.
best to you.
Same to you and to your team. Thank you, Aaron.